of tension there. Alright, so that's it.
You're not doing anything other than...
No, just letting the weight of my leg fall there. Okay, so that they have to sit down on the ground for that. It's handy to have one for them where they, as much as possible, I try and make it as easy as possible for people to do the exercises. So if you can come up with exercises when they're sitting, all the better. So exact same thing, just sit there. Okay?
Coffee table?
Yeah, whatever.
Do they need to be the same height?
No, not necessarily, but you're not going to kind of have it up here where here's under tension. So just comfortable, get them comfortable. We're just trying to increase this movement here. How would you progress that on?
Put it
Foam roller, put it a little bit higher. Okay, like that. A little bit of downward pressure, just proximal to the knee. Using your head, you're not jamming it down. You can hang a little weight off it, no more than 2 to 4 kg, or just a little bit of extra pressure like this. Not for the first few days, but you can show them how to progress it. You might apply a little bit of downward pressure like that. You're going to build up to doing an hour a day of extension. So, might start off with a minute or two here or there, build it up to 5 minutes, 10 minutes, do 4 or 15-minute sessions a day.
But never an hour straight.
Well, things would stiffen up and get sore, most
Like
likely.
if they're watching TV, you tell them to take it down.
I would, yeah, because then they'll go, oh, Jesus. You don't want to keep anything in that position for that long. Just use your head.
5
Use your head.
minutes what?
Sorry?
5 minutes.
Yeah, but building up to 15 minutes at a time. But yeah, you're not going to go straight into 15 minutes. Build it up gradually, get them comfortable with it. What's one of the things that discourages movement, apart from, say, like you said, at the joint, muscle locking it down? What else discourages it? Sorry?
Pain.
Pain, what else?
Not moving it.
Not moving it, what else?
Guarding.
Fear. Yeah, fear and guarding. So, just, like, you know how you're asking me here, not an hour, a few minutes, just gradually increase it. Okay, do it gradually. So that will depend on the type of patient you have and so on. But yeah, another way you can do it is lying supine with your leg over the end of the bed. So just lie it so that the bed is coming to about there, and so this is straight. You know what I mean? Lying like that with it over the edge of it. Okay, and again, you can hang something off your ankle there if you need to.
Would you make sure that he's able to do it for an hour before adding pressure?
An hour in sporadic times during the day, not necessarily. But what I would say is, as you feel more comfortable with it, add some gentle pressure yourself. Okay, rather than saying in 4 days' time, add 20% pressure. Okay.
Would you do that in a more dynamic way for somebody, like, rather than a static? Would you
No.
encourage them in a graded,
No.
dynamic way? No.
No, not in first.
Any reason or?
Yeah, they've just had surgery to their ACL, so you're not going to get them in any way kind of loading it at all, and also it's as stiff as a board.
Okay.
Okay.
Could you add,
Whereas first 2 weeks, lads, gentle, nice and gentle.
just saying maybe after the first week, Tommy, could you introduce TheraBand around the ankle as a resistance when they're straightening the knee? You know, just below the tendon.
What tendon?
The quad tendons.
Where are you,
Keep
where,
everything healthy
where are you putting the TheraBand?
around the ankle.
Show me.
So if they're on the bed or on the floor, get TheraBand around here, and we can start getting them to introduce some resistance stuff.
Right, so what are we working on now?
ACL,
And what movement?
extension.
Extension. So this is purely extension.
So,
So what's that movement there?
So if we're in this position here,
Well, you're not going to be in that position. Because you can't move your leg.
I'm saying after a week or so.
Yeah, you can't move your knee like that. After you can't move your knee.
I know what?
You can, but you can't do what you were doing there. So what are the two movements we need to get?
Flexion extension.
So let's just get extension.
Right.
Okay? Extension, chill out, relax. They've had surgery. First few weeks, first 7, 10, 14 days, Jesus, go gentle. Okay? Ice if they're sore. Bit of compression, anything to help that swelling or damage. And then we're just working now on extension, so there's no confusion. It's straightforward enough. Increase the height or add a little bit of overpressure once you're comfortable with it. It's done little and often throughout the day, building up to doing it for 15 minutes at a time. And that's extension done. Everyone okay with that? Yeah, so that's just extension. We are going to move on to those exercises you were shown there in a minute, but that's more flexion. Okay? So is